Hi, everybody. Happy Friday. Happy Freedom Friday, as I like to say. And I'm hoping that the information that I share will assist us all in tapping into our freedom, even though we're staying home, even though we're self-isolating and may feel like we're very confined, but we can still be free. We've been talking for the past few days about the most vulnerable communities among us, and I want to continue that tonight by talking about mental health and COVID-19. Mental health while we're dealing with a coronavirus pandemic. And for those of you on Twitter, I promise you, I have been trying my level best to employ all of my expert communication skills to make this as succinct as possible. But if this video goes over because I got a lot of information to share, then you can find the whole vid on my Instagram page or on my YouTube channel. I want you to get all the information, not just this short snippet. But mental health, we can all agree the sudden changes that we've been dealing with, and I got my notes here because I don't want to forget anything. Health implications, lack of information from our federal administration, from our leaders, financial ramifications, people losing jobs, people being in self-isolation who are used to contact with other people. All of this is enough to cause anxiety levels to be high, even with people who thought before this that they were kind of at the tip-top peak of mental health. I don't know those people, but if you were one of those people, then this is enough to take anybody over the edge, right? But even if you were one of those people, we are already dealing with more than 16 million Americans who are on a daily basis suffering with or coping with, surviving with depression. These are people who every day are facing either a depression diagnosis or something in the depression family. And so in addition to those numbers, we've got the trauma of our current circumstances that are causing people who were not dealing with depression to be triggered, such that they are dealing with depression and anxiety now because of this pandemic. So what I'm hoping to do is first say, you're not alone. There are millions and millions and millions of us out here who either were dealing with this before or are dealing with it now due to our current circumstances. But second, say to you, we've all heard, right? Check on your strong friend. I'm hoping we can change that. You don't need to just check on your strong friend. You need to check on your strong friend, your not so strong friend, your weak friend. I want you to check on your frenemy, right? Because everybody needs somebody to be looking after them during this period. And do you know who you need to check on first? You. How are you doing during all of these life changes, during all of this upset, during this self-isolation, during this home imprisonment scenario? Are you handling it well? How do you gauge that? Checking my notes. Are you dealing with sadness? Are you anxious, angry, paranoid, sleepless, raging, short-tempered? Would you even say that you're abnormally depressed? And if so, what are you doing about it? What are you doing to cope? Do you know what the coping mechanisms are, and are you using them? Are you praying? Are you meditating? Are you exercising? And I mean every day. When you get up in the morning, you're talking to God, right? You're doing your meditation. Do you have any yoga in there? Are you walking the block, staying a safe distance, 6 feet or more away from other people, but are you walking? Are you getting on the treadmill? If you have a treadmill, are you doing something to stay active? Are you taking your vitamins and your supplements? Because we need that vitamin C and that vitamin D, because it'll just kind of help us in this headspace and run all through our immune system, so we'll have a better outlook in a dark situation. Are you eating healthy? Seeking counsel. Breathing. Literally inhale, exhale, and repeat. Like in for 4 and out for 4, and repeating that cycle until we can kind of calm down. Those are all things that you can be employing. And if you are not, I would advise, implore, beg you to do so for the sake of you and your family members who you are self-isolating with. Are your friends, family, frenemies doing the same? Because third, am I on third? Might be on fourth, who knows? If not, if you want to get a better grip on things for you and for those you love, there is help. You are not in this all by yourself, even if it feels like you are alone. So I want to take you to, I always have sources. I do my research and I want to send you someplace. I'm not just talking for my health. I want to send you somewhere where you can actually get some help, even if that help isn't me, even if I'm just the catalyst pointing the way. The American Psychiatric Association, the APA, and it's psychiatry.org is the website. And listen, if you're watching me, then you have web access. But if you're watching me and you know people who don't, remember what I told you on yesterday's vid. Comcast right now is offering 90 days free. So you can sign up, or if you are on an inexpensive program right now, you can get on the free program during this period through Comcast. So go to Comcast and sign up, get your free plan, and then get your counseling boo. American Psychiatric Association, psychiatry.org, has specific coronavirus resources, including free, FREE, webinars for telemedicine. And if you don't know, just yesterday, the CMS, the Center for Medicare and Medicaid Services, released new guidelines just yesterday for telehealth. They're lifting the restrictions so that whereas before for Medicare and Medicaid, if you were required to go in an office or you were required to go into what they call a source of origination, no more. You can receive your services, your psychiatry, your psychology, your counseling services in your home, and them still be approved under your Medicare and Medicaid. So they're eliminating the excuses or the legitimate reasons why people may think that they have to have an interruption in service. You can have a continuity, a continuum of care, because as of March 17th, the CMS and the CDC and the psychiatry associations have gotten together, and now telehealth is available to you. Just the way I'm talking to you right now, you can, covered by your government insurance, your Obamacare, your Medicare, your Medicaid, your fancy insurance, whatever it is, you can talk to your counselor or your psychologist or your psychiatrist the same way I'm talking to you, and get the counseling that you need. And that includes new sessions. So don't think just because you haven't had the services before that you can't get them now, because you can. So that is available. And also the APA at psychiatry.org is providing resources for community leaders, resources for advocates, resources for families. So if you are a family in need, you can find out there things that you can do to help yourself in your family, things you can do to help your children with what they're going through. School's gone, daycare's gone, teachers gone, talking to family and friends each day. A lot of times people don't even realize like the value of the human touch and human interaction, what that can do and what we are lacking. But there's help. So go to these sources. Finally, this is temporary. So let's eliminate permanent consequences for a temporary situation. I want you to go to the National Suicide Prevention Lifeline. If you or anybody you know is talking about checking out of here because things are too much, we want to interrupt that. And I'm trying to keep it together. Listen, hear me. It's not worth it. We need you. Stay with us. The National Suicide Prevention Lifeline, 800-273-8255. Call, and someone is available to talk to you if you need the help or to help you help your family member. There's a chat available as well if you go online. Also, crisis text line. Text TALK, TALK, to 741-741. You can text and you can chat back and forth online. Also, finally, disaster distress helpline, 800-985-5990. And you can text Talk with Us to 66746. So the help is out there, y'all. And I finally just want to give you one more. If you are not following Dr. Carolyn Leaf, she's a neuroscientist, mental health and mind expert, best-selling author. Listen, y'all, she's bad to the bone. But if you're not following her, Dr. Carolyn Leaf on Instagram, Dr. Carolyn Leaf on Twitter, Dr. Carolyn Leaf on Facebook, please do so. She's providing content every single day that can give you tips on how to get through this. And she also has a great podcast for all of us who are just in here now, nothing else to do, watching reruns, watching programming that isn't going to help at all. Check into her podcast. She's giving you tips that can help you get this brain activated, and tricks and tools that you need in order to survive and thrive. Dr. Carolyn Leaf. Okay. I know that was long, y'all. That's all I have. It was a lot, right? I'm rooting for you and for us so that we can come through stronger, better than we were before. I am praying for you because I believe in the power of prayer. And I don't think I have to know you for my prayer to work. As a matter of fact, I'm going to come back to you all. My next video is just going to be prayer because I'm praying for you when I get off of here. I may as well pray for you while you can hear me. All right? I love you. Stay strong. Bye.